I want to thank the Philadelphia Senior Center for hosting us and thank New Portland for making the facility available to us. This is going to be a mostly fun event. We do a lot of political events where we're trying to encourage a political official to do the right thing. This is a lot more fun because we're going to thank a political official who's done the right thing and has done the right thing over and over again in his tenure in the Senate and even before that. Not only did he vote to save Medicare and Medicaid last week, but he's been a big proponent of the Affordable Care Act, and before that of child health care programs and many others. It's not entirely a fun thing because we had to have a vote on saving Medicare and Medicaid, and that's something that really shouldn't be happening. There shouldn't be threats to two programs that are critically important, not only to seniors, but to low-income folks, to folks who need long-term care. You would think that 1 year after one of the most important accomplishments in domestic public policy in 40 years, the Affordable Care Act, expanded the ability of Americans to get health care, as we'll see in 2 years when that program goes fully into effect, that we'd be celebrating that, not talking about repealing it or talking about ending traditional Medicare or radically reducing funding for Medicaid. But that's the situation we're in. So given that we're in the situation, it's really good that we can thank Senator Casey and others who've been standing up and doing the right thing. We're going to have a couple of quick speeches, and we've Action United and Penn Action asked people around the state to send letters in. Thank you letters to Senator Casey that talk about why these programs are so important to them. We're going to read a couple of those letters, and then Senator Casey will respond to us. So first I want to introduce Dorothea Wilson, who's the president of the Ask Me DC 47 retirees, and is speaking today on behalf of the Alliance for Retired Americans.
Good afternoon. So glad that you took time out of your busy schedules today to come out here and join us for this event. We have so much to thank Senator Casey for taking his time and thinking about the seniors, because once you become a senior, you start feeling like you're second class, and no one wants to think about us anymore. And then when something goes wrong with the economy, it's the seniors. Anything that goes wrong, it's our fault. It's not that we worked all our lives and decided it wasn't our fault that we got old, or getting old, I should say. But it's that we're it. Anything they want to cut us, But we want to thank Senator Casey for stopping that Ryan bill, which would have been detrimental to us. Medicare would be no more like we see it today. Then you have a insurance. It would be like a program that you'd have to go to your insurance company. Now we know what insurance is all about. You pay your money, then they'll say, well, that part isn't included. Then you go to the old folks' home, and then they'll say, well, you didn't have enough Medicare. Or then you put you in a place where a little room, little dark corner, and you have been working all your life, and this is your end. I feel that our last days should be our best days, and heaven our resting ground. And Senator Casey, we want to thank you. Thank you on behalf of the Pennsylvania Alliance for Retired America for your recent vote against the budget plan put forth by Congressman Paul Ryan and by the Republican majority in the United States House. We'd like to present you with this thank you card for protecting us. And at this time, I would like to read you a few of the letters that came through. He's going to get more letters. Just like he got mail to stop Ryan, he's going to get mail to tell us, thank you, thank you, thank you. Tell him. Dear Senator Casey, thank you for standing up and defending Medicare. I and millions of other seniors across the state are dependent on Medicare. I appreciate you taking a strong stand by voting against the Ryan budget in the Senate. You said that if that budget plan were enacted, traditional Medicare will no longer exist in 2022. Instead, our elderly will get a voucher to purchase private insurance, but the voucher won't keep pace with health care costs. You were correct. I want my son, who has been paying into Medicare, to have the same or better protection than I have, Social Security is a promise by our government that we pay into the program. It will be there for us in the future. Thank you once again for protecting our interests. Sincerely, David. Dear Senator Casey, as now 75-year-old, I can't believe it, I certainly appreciate your decision to support Medicare in the face of strong opposition that saw fit to see the budget from Senator Ryan's perspective. There are people like me who take no medications and who have no health issues who contribute to Medicare as insurance for that time when I might need care, but who would help to shore up the system so those with health problems can benefit. Medicare is a program that works for everyone, our adult children and for us. It seems that most would like to settle our financial dilemmas on the backs of those who can be supported. I am pleased you did not count yourself into that number. Thank you so much, Marion. Now we could go on and on and on with the letters, you know, saying thanks. But we just want to say thank you, thank you, thank you. Thank you for being you. And thank you for standing up for the seniors. And God bless you.
Thank you very much. I first of all want to express gratitude at this event where we're expressing gratitude. I'm really humbled. I've been a public official in and out of campaigns and in and out of various levels of government for the last 15 years. I'm not sure in all those 15 years there's ever been an event where someone was thanking me and thanking other members of the United States Congress for help. And I say that very humbly, and I also say it because I want to remind myself and remind anyone listening to my voice that I come here as well with gratitude in my heart for what you've done for me. And that's not just an expression of gratitude for today's event, which I thank you for, but I also want to express gratitude for what the people in this audience have done for many, many years, decades in fact, to make sure that we have the kind of country that we do. So when we act to protect Medicare or Medicaid or any other action that I would take to protect those programs, I do it with a sense of gratitude for the work that's been done by people in this audience today. You know, too often we forget that this audience, people here today, you've already sacrificed. You know what it's like to work hard. You know what it's like to save, to sacrifice, and build your country, and fight for your country in some instances directly. So today when I express gratitude to you, I say it to more than one generation, to the people who fought our wars, worked in our factories, taught our children, built the middle class, built the kind of economy that America has been able to enjoy for all these decades. And of course, as well, we thank you for life and love that you've given to us. And the least that we can do, the least that a public official can do, is to stand up against attempts by some politicians in Washington, not all of them, but some, who want to end Medicare as we know it. That was a bad idea yesterday, it's a bad idea today, and it will always be a bad idea. And as long as I'm a United States Senator from the Commonwealth of Pennsylvania, I will fight it, and we will win that fight every time. You know, I thought I recall in the debates about health care, there were some guys and gals down in Washington who were, you know, spewing a lot of hot air about health care, about what they thought would happen if we passed a health care bill. And one argument they kept using, happened to be false, but that didn't stop them from using it, is that somehow there were some folks in Washington who wanted to put the government between someone and their doctor. Remember that argument on health care? They've used that over time. But here we are debating Medicare. It's hard to believe that we have folks that want to go take a different path on Medicare. And one of the things they're trying to do is not just radically change Medicare and end Medicare as we know it, but for whatever reason, they seem to want to put an insurance company between you, a Medicare recipient, and your doctor. That's also a very bad idea, and that's one of the reasons why it went down to defeat. But you know what, there's a lot of talk as well when this proposal was initially made, that somehow if you're below you're below, under 60 or over 65, you don't have to worry, and a lot of the changes would take place down the road to another generation, or at least folks a decade or so younger. But you know what? That was misleading as well, because one of the changes that was enacted in the last year was that folks who were over the age of 65 were going to finally get some help with preventative care. We're going to finally get some measure of help, not total, but some measure of help on filling that coverage gap on prescription drugs, right? The so-called donut hole, which is actually a nice way of saying something that's pretty severe and pretty serious. The gap in coverage, and where someone has to pay out of their own pocket. And I think in the debate, a lot of folks forgot, or were trying to mislead us into thinking that this wasn't going to affect people over a certain age level. And that misleading tactic as well is one of the reasons why we're able to be successful in the vote. I'm just pulling out, I won't read this to you, but I'm pulling out a report that our committee did just a couple of days ago, the Joint Economic Committee. It's one of those rare committees where you have senators and House members on a joint committee. I just happen to be the chairman of it, so I get to direct some of the research. And I asked our folks to do some research on out-of-pocket costs, the daily costs that Americans have to come up with to pay for health care, or in this case, help pay for prescription drugs. And here's the headline on this May 20th report. It says the following, and I'm quoting, "The Republican Medicare plan, healthcare expenditures would double for elderly in every state." And that's a number that was calculated based upon if their plan went into effect this year, what would happen in a decade. Here's what it would mean for Pennsylvania. I'll skip to the last page in the state-by-state analysis. And again, this is out-of-pocket costs for prescription drugs. Out-of-pocket health expenses for a typical 65-year-old enrollee in 2022 under traditional Medicare, if we stay where we are, which is the right thing to do. Here's the total amount, $6,100. Not a small number, but a lot less than it would be if we listened to those other guys and gals who wanted to make changes in Washington. That instead of $6,100 out of pocket, it would go up to $12,403. Now, I'm glad we have a third column, because I'm not great in math sometimes, so they did the math for me. Here's what it would mean. Here's the difference, and some of you already done the math in your head. $6,303.27. Now that's one of the effects of what they're trying to do with Medicare, just in terms of out-of-pocket costs. It doesn't even get to the bigger issue of what it means for your care and what it means for you and your doctor and your medical care. So I come here today with gratitude in my heart for so many things today, and for folks in this audience who have helped me in more ways than one over my lifetime. But I also come here today not simply to express gratitude, but also to recommit myself. Because in a way, this event today is an event about renewing our commitment and recommitting ourselves to making sure that we continue this fight. Because they're not done down there. You got some Washington politicians who are going to keep trying to do what they've tried to do the last couple of months. And I know, we all know, we don't need a lecture from someone else about how important it is to create jobs, how important it is to cut costs, how important it is to come together, Democrats and Republicans and independents, and lower the deficit and deal with our debt. We know that. We don't need a lecture on that. We don't need a lecture on how to do it. You've done it in your lives. You've done it over generations, in your own families, in your own communities. You've sacrificed already. And you know what it's like to be a member of a family. And my parents taught me that when we're talking about a family, that the family of our Commonwealth and the family of our country must leave no one out and must leave no one behind. So I'm here today to say thank you, but I'm also here today to say I am recommitting myself to this fight. We're going to get this right. We're going to make sure that we deal with those tough questions, but we're also going to make sure that we're not going to do it on the backs of folks who did fight our wars, who did work in our factories, who did teach our children and built the middle class and gave us life and love. Thank you for your commitment. I'm recommitted today as well. God bless you.